Hi guys, how are you doing today? I'm Dr. Scott Howard and I'm going to visit with you briefly on the most weak muscle there is in the low back and pelvis. Really, if you have low back pain, a lot of times it's because it's taking the brunt of weak muscles in the hip and pelvis. One of the main ones is the glute medius muscle, and it is the one that abducts, which is bring your leg out to the side. And so I was going to show you an exercise that you can do to strengthen that at home without any weights or anything. Now, you can only contract this muscle if it's turned on neurologically. A lot of times that you'll have muscles that have been turned off neurologically, kind of like the fuse box or the breaker in the house, where an electric circuit has popped and there's no electricity to whatever it goes to. Same thing here, the nervous system can protect a muscle from being injured by shutting the contraction off, and it keeps it from tearing, but the deal is it doesn't contract then. So you don't want to walk around with a whole bunch of muscles that have been shut off, because then your low back and pelvis is unstable. So we're talking about the glute medius muscle. Now this muscle here, you can see the socket right here. This is where the hip comes in and it goes down the leg. Anyway, this muscle starts right in here and it attaches to the hip socket itself. Now, I wish I had that and then I could do the tape like I did this one here, but really that muscle does a movement outward of the leg. I'll show you. Alright, so what this muscle is doing is it is moving this leg outward like this. And if you have an altered posture to where it drops to this side, usually this muscle is going to be weak, and so if you strengthen it, it pulls it back straight again. So what we're going to do is we're going to exercise this muscle if it is actually working neurologically. So if it's not, you can call me, I'll turn the muscle back on for you. But anyway, I'm going to show you this exercise. So you're at the house, you lean up against the wall. You don't really lean, but you use the wall as a stabilization, and you just hold yourself here. So you're going to pick up this leg and you're going to drop the pelvis outward here. So what you're going to do is you're going to start here, you're going to push inward with your pelvis. You're going to contract this muscle here. It's not a moving this leg. You'll see it drops and then it pushes in, drops, pushes in. So you're exercising this muscle right here. So same thing on the other side. You're just going to pick up this, you're going to start here and then you're going to push toward the wall. Start here, push toward the wall. Here, push toward the wall. You want to do slow contractions toward the wall and then away from the wall. Don't go toward the wall and then let it go. You want to do 1 second, 1 second. And not only that, but if you want to do even more, you do 1 second and then hold it there contracted and then slowly let that go for 2 seconds. So it would be to where you're dropping in, starting here, you're pushing here, you hold right here, and then slowly let it go instead of doing this. That's not going to really do anything. You're probably going to end up straining yourself even more and having another muscle shut off, and then you're at the creek. Do those 2 or 3 sets of 10 once a day if you really want to get serious about strengthening. If not, 3 sets of 10 2 or 3 times a week. Anyway, so I'm Dr. Scott Howard. If you like the video, comment below. Also, if you haven't subscribed to the YouTube channel, definitely hit subscribe below and click the button icon, and that notifies you of any videos that I send in. Practice this. We'll see you.